for the annual Obstetricians and Gynecology meeting. And joining us this morning is Mary Jane Minkin, MD, Clinical Professor of OBGYN at Yale University School of Medicine. And she's going to be talking about helping women cope with menopause this morning. Good morning. Thank you for being here.
Thank you, Erica, for inviting me.
Really appreciate it. So we've seen some some scary headlines in the news recently about the risks associated with menopause treatment, specifically hormone therapy and that type of thing. Is it safe or not?
The answer is, in general, hormone therapy is quite safe. I mean, the concerns about cancer risks and things like that are unfortunately greatly overplayed, in media and things like that. However, I well understand women having anxieties about things, and the good news is there are a lot of things that women can do short of medical intervention to really help a lot of the menopausal symptoms that are out there.
Can you talk about some of those real briefly?
Sure, and again, I know we're morning show here, so we'll try to talk to our adult audience here, that the major problems that women can get into with perimenopause and then subsequently into menopause are things like hot flashes, night sweats, problem sleeping, and unfortunately vaginal dryness can happen to many, many women.
All right, so we have some fact versus fiction to go through this morning, and we're going to start with the first one, which is menopause is a medical condition that can only be treated with pharmaceuticals.
And the answer is not at all. There are many lifestyle changes women can use and many things as far as over-the-counter remedies that can be quite helpful for women.
Can you list off a couple of those?
Sure.
Lifestyle ones especially?
Absolutely. I mean, for lifestyle, with the hot flashes and particularly the night sweats, keep your house cool. This is easy. Wear layered clothing, so if you get a little hot, you can take off a cardigan but have a shell underneath. These are easy things to do. At night, you can use things like, I have products like cool mattresses and mattress covers and pillows, the chilling pillows, which can be used to help cool you down so you can sleep better. Wicking pajamas, things like that, that'll work very nicely. So those are some simple things women can do. As far as things like the dryness for the vagina, which is a common problem, there are many things, and many things that women don't understand. For example, there are moisturizers that women can use on an ongoing basis. There's a product like Replens, which is available over the counter, that women can use very nicely on an ongoing basis, and use a lubricant at the time of certain other activities, which can be helpful to them as well. And again, no scripts necessary.
Okay, cool. Let's get to the next fact versus fiction, which says symptoms of menopause will go away a year after menstruation stops.
Yeah, this is a sort of a common belief that's out there, and I think it's becoming more common, and unfortunately it's not true. Now, plenty of women get no hot flashes whatsoever, and periods just cease, and that's great. But for the rest of us, the 80% of us, there are hot flashes that are out there, and unfortunately they can last for many years. 15% of women will get hot flashes that persist even 10 years after menopause. They do get better over the course of time. That's the good news, but they can persist.
Okay, the last true false I know is a big fat false. My sex life is over after menopause. No way, right?
False, false, false. I can't emphasize that enough. The answer is that many women, the majority of women, can basically carry on a very normal, healthy, active sex life. Very important to realize. And again, there's that old phrase out there, lose it or, use it or lose it. I get that backwards. Use it or lose it. And indeed, there is some truth to that. And again, getting back to the issue we talked about with dryness, there are lovely things. There are, basically long-acting moisturizers, things like Replens. There are topical lubricants that can be used, and everybody can use these and really maintain pretty good activity.
All right, let's go through a couple of other common questions that a lot of women have when it comes to this subject matter. First of all, are there side effects from estrogen, like increased risk of breast cancer?
Again, with short-term therapy, the answer is no. With long-term therapy, there are some questions, but again, you want to be in contact with your healthcare provider to discuss all the pros and cons, risks and benefits.
Let's talk about what is pH and how does it affect feminine health?
Okay, well, indeed, and this does tie into the menopause stuff, but unfortunately there are young women out there, premenopausal ladies, who can have problems with pH, and again, trying to keep a more acidic pH in the vaginal region is very much healthier as far as keeping infections away and stuff like that. And again, moisturizing will help, and also there are pH balancers that can be used to keep the tissue more acidic, and something like, for example, like Refresh, which again, menopausal women can use and premenopausal women can use as well.
Lastly, one more question. Are you too young to be menopausal in your 30s and 40s, and what are the symptoms?
Well, can we have an hour of time? That would be lovely, Erica.
We've got about 30 seconds.
That we could do. But indeed, Indeed. That the range of age for menopause, I define basically as 35 to 60, and any range, any number in there, I've seen folks with it. So hot flashes, night sweats, vaginal dryness, these are all problems that women can experience. Again, if you're experiencing these things, again, there are a lot of fabulous OBGYNs in the San Diego area that women can consult and get some advice and guidance. And of course, you know, I know you'll have information on your website, but a great website is menopause.org, which is the Menopause Society website, also acog.org. A lot of good information out there.
Very good. Mary Jane Minkin, MD, thank you so much for being here this morning. We really appreciate it.
Thank you so much.
Important stuff. All right, Raul, let's get it on back over to you.